So good afternoon, Professor, and good afternoon to everybody. So today we would like to give a presentation about healthcare system in Czech and Germany. So next we're gonna show you guys the table of contents. First is the introduction. Second, it's a healthcare system. Third is gonna be funding models. Fourth, is gonna be eligibility. Fifth is gonna be contract. Sixth, we're gonna talk about primary care and reference. So seven, we're gonna talk about the quality of care. Eighth, we're gonna talk about healthcare innovation and technology. Last, we're gonna talk about challenges in healthcare. So first, I would like to talk about the introduction. So in Germany, a healthcare landscape marked by efficiency, quality, and accessibility comes to the forefront. So also Czech Republic, we accounted a universal healthcare system financial for a combination of the health insurance, so contributions, government support, and pension co-payments. Next, I'm gonna talk about the healthcare systems Czech and Germany. So Germany, efficiency and quality focus Germany due funding healthcare systems combines statutory and private insurance of the widespread accessibility, notable for technological advancements and strong emphasis on the preventive cares. So Czech Republic universal healthcare funding from the insurance, governments, and the co-payments facing challenges like the regional disparities, ongoing modernizations effort just involving healthcare needs. Basic to these two countries, we have something similar to talk. So next, I'm gonna talk about the funding models. So health system funding models in Germany. Germany healthcare systems operates on the dual funding models, so combining contributions from the statutory health insurance, and the private insurance. So statutory health insurance, so it's the mandatory coverage. So the majority of Germans, 90% people are covered under the SHI. So contribution-based HHI is funding from the contribution shared by the employers and employees based on income. So equal access. So promotes equal access to medical service for large segments of the population. For the private health insurance PHI, so voluntary coverage in individuals with the higher incomes and the civic professional can OPT for private insurance. So for the individualized plans, PHI offer the personalized so coverage, the additional service, and more flexibilities. So supplementary coverage, many choose PHI supplements to SHI coverage from the enhanced and the benefit and the faster access to certain medical service. So next, we're gonna talk about the Czech one. So healthcare system funding model in Czech Republic. So the healthcare in the Czech Republic relies on the combinations of the funding sources, emphasizing universal coverage and the private phase financing. So for the compulsory health insurance, universal coverage, near all the residents are required to participate in CHI, so ensuring both healthcare accesses. So income based on the contributions, funding in the differs from the contributions based on income shared between the employer and employees. So government support. So additional financial support from the government contributes to the overall funding. So government funding. So public budget allocations. The government plays the significant roles in financing healthcare. So contributing funds from the national budget. For the pension co-payments, supplemental fundings, patients may include co-payments to certain services, so medications and supplemental treatments. So income adjusted. So co-payments are often income adjusted of the insurance for disabilities. So for the last one is non-profit health insurance companies. So managing for the fundings health insurance funded managed by non-profits. So to ensure financial sustainability. So regulation of the oversights. Government regulations for oversights ensure fair practice and the quality standards. That's all my part. I'm gonna pass to my colleague to talk about next part.
Hello everyone, my name is Y, Now I would like to present about eligibility for both countries. This will explain who are covered under the public and private health insurance. Participation in public health insurance is compulsory by law for all permanent residents and people working in both countries. For the Czech Republic, currently there are 7 public health insurance funds. Entitled persons must register with one of 7 health insurance funds. The largest health insurance company is the General Health Insurance Company, which is called Visa P in short form. It provides coverage for around 60% of the population, and the rest of the population are insured by the other public health insurers. So we can say almost every people in Czech Republic are under public healthcare system. The state also ensures that it has the financial capability to pay for healthcare services. Czech citizens, employees, and even the self-employed persons from other European countries, if they follow their rules and regulations, they all can be covered by public health insurance. Migrants from outside of the European countries who are not in employment, including children, pensioners, and students, have to choose private health insurance. The Czech public health insurance system is based on obligatory participation of insured person, so there is no possibility of voluntary participation. Every person is insured individually and there are no derived rights for family insurance. Okay, to talk about the German healthcare system, 87% of residents are covered by statutory health insurance. 11% of the population are insured by private one, and 2% of the population, example soldiers, police officers, and refugees, receive health insurance through specific government scheme. For your public health insurance, how much you have to pay is linked to your income. As of 2023, all employed residents who can earn less than 5,550 euros per month are eligible for this public health insurance. Those who receive unemployment benefits or a German pension, including retirees, are also covered under the public healthcare system. On the other hand, private health insurance is determined by factors such as age and health condition. For that reason, it's important to note that the costs tend to increase significantly as you age. And people with stable and good income can also choose private health insurance. For example, if you are employed and your salary increased to over 5,550 euro, you can choose private one. Moreover, non-residents as well as students over 30 and PhD candidates need to have private insurance coverage to access the health care. And in Germany, family can be insured for free through you, meaning that in certain conditions, family co-insurance extends to the spouses, saver partner, and children up to age 23 or 25 if they are studying, so they can insure by public health system. So in comparison between those countries, Czech Republic doesn't have family insurance and Germany has family insurance. Moving to the next slide, I'm gonna talk about the contract. In Czech Republic, for public insurance, each insured person can change his or her health insurance company twice a year, on 1st January and 1st June, with no penalty imposed. And the private health insurance is subject to insurance company's approval. If the client is considered too risky, they will not insure him or her. In Germany, the statutory health insurance You must have been with your current insurance company or provider for at least 12 months before you can switch to another provider. So for the private one, it is usually involve a medical test or health questionnaire during the application process. If you have any pre-existing or chronic condition, please note that they have right to reject your application. So here, I'm gonna talk about primary care and referral. General practitioners, also known as family doctors, play a key role in both healthcare systems in both countries. They provide primary care services and serve as the initial points of contact for patients for their routine healthcare needs. They are often responsible for referrals to specialists, diagnostic tests, and preventive care. While the Czech Republic has a primary care system, patients may also have direct access to some specialists without a referral. But if you go to the specialist without referral, it could delay any treatment you need because they don't have your medical record. So it's recommended to visit a general practitioner to get a referral before contacting a specialist. So in Germany, the German healthcare system follows a gatekeeping model, meaning that patients typically need a referral from their general practitioner to access specialized care, such as seeing a specialist or undergoing certain medical procedures. So this is a difference between Czech Republic and Germany. For the rest of the slides, my friend Elida will keep doing the presentation.
Hello dear students, so now I'm going to present to you the points quality of care in Czech Republic and Germany, and also healthcare innovation and technology and challenges in healthcare system of both countries. So first of all, I will start with the quality of care in Czech Republic. We have in Czech Republic the universal coverage, which means that the Czech Republic also has a universal healthcare system funded through mandatory health insurance contributions, and that the majority of healthcare services are covered. We have efficiency. The Czech healthcare system is also known for its efficiency, providing good quality care at a lower cost compared to some Western European countries. And we have the primary care emphasis. That's when the system emphasizes primary care with a strong network of general practitioners providing initial healthcare services. In Germany, we also have a universal coverage, but in Germany, there is a multi-payer healthcare system, a universal multi-payer healthcare system, and everyone is required to have health insurance, whether though a statutory health insurance or a private one. Also high standards. German healthcare is known for its high standards. The country invests significantly in medical research and in technology, and the access to specialists. Patients in Germany have relatively easy access to specialists, and the system prioritizes preventive care. We can sum up for both countries that they place importance on preventive care, early detection and treatment of the illnesses. The quality of care is generally high, but it's also influenced by factors like doctor-patient ratios, infrastructure, and funding. Second, I'm going to talk about the healthcare innovation and technology. Again, starting with the Czech Republic, we have the telemedicine. The Czech Republic has been embracing telemedicine solutions, especially in rural areas. This helps to improve access to healthcare services and enables remote consultations with the doctors. We have the research and collaboration. Czech Republic researchers actively participate in international collaborations, contributing to advancements in medical science and the collaboration with European partners and participants in the European Union research initiatives are very common. And then we have the medical imaging technology, which means that the Czech researchers are and companies are making advancements in medical imaging technologies, and this includes innovation like MRE, CT scans, and other diagnostic imaging tools for more accurate and early disease detection. And we have the genomic research, which is gaining prominence in Czech Republic, contributing to a better understanding of various diseases and paving the way for personalized medicine when it approaches. For Germany, we are starting with the innovative medical devices. German companies are renowned for producing high-quality medical devices, from diagnostic equipment to surgical instruments, and German innovation plays a significant role in the global healthcare industry. And we also have the digital health. Germany is making strides in digital health. The implementation of electronic health records, telemedicine, and digital health apps is gaining tradition and enhancing patient care and accessibility. We also, for Germany, have the healthcare IT, which the country has been investing in healthcare IT infrastructure, facilitating the seamless exchange of medical information between healthcare providers, and this includes initiatives for a secure data sharing, so for interacting with each other and sharing securely data. And we also have the robotics in surgery. German hospitals are increasingly incorporating robotic assisted surgery, allowing for more precise and minimally invasive procedures. This technology enhances surgical outcomes and reduces recovery times. Last but not least, I want to shortly talk about the challenges in healthcare for both countries. So for Czech Republic, we have the funding and resources as a big problem, the regional disparities, the integration of digital health, the preventive care awareness, and patient education. And in Germany, we have as a big problem the aging population, healthcare costs, workforce shortages, bureaucratic complexity, and also mental health services. So thank you guys very much for listening our presentation. I hope you enjoyed it. If you have any questions and any feedbacks, please feel free to share them with us. We will be very happy. And also at the end of our presentation, we have our references. So thank you very much for listening to us.